I'm doing my presentation on abdominal aortic aneurysms, also known as a AAA. The aorta is what carries oxygenated blood to the rest of your body. And the abdominal aorta specifically is carrying blood towards your kidneys and then also towards your legs. So there's a lot of blood flow going through the aorta in that location. An aneurysm forms when there is a weak spot in the artery's walls and causes it to expand. It's considered also an aneurysm once it's expanded more than 50% of the original width of the artery. This usually occurs in what's called a fissiform state, where it expands or balloons out around the aorta in all directions. Sometimes it can be saccular, where it's just like a little bulge off to one side. The aneurysms form usually from high blood pressure or a connective tissue disorder that causes a weakness in the artery wall. Other risk factors can include high cholesterol, diabetes, obesity, smoking, if you're male and over the age of 60, atherosclerosis, and there's a strong genetic hereditary component as well. Usually these grow slowly and you don't realize the signs and symptoms. Usually it's found on accident while researching or doing procedures for some other medical issue. And if you do find it and it's small, then usually it's just monitored. Once it's over about 5 centimeters, that's when they wanted to go in for surgery. They usually will do a graft, or if they can't graft it, they might just cut that section out and shorten your aorta some amount and then put a stent around it so it prevents it from ballooning out later, since surgery obviously will weaken your vascular walls. And the issue with aneurysms is that they can be extremely life-threatening if they rupture or if they tear, because all of the blood flow going through your aorta in that area would be just dumping blood into your abdominal cavity, and you'd be losing a lot of blood really fast, and that would require immediate surgery. In that case, you would be experiencing severe, sudden, sharp pain going in your abdomen and also in your back, and you might be able to feel a pulsating mass near your navel. Those would be really bad signs, and it's like impending rupture. So you definitely want to get to the hospital before then. I hope you learned something.